So, the question for today is, if I have a family history of breast cancer, can I make any changes in my diet to reduce the risk of getting the disease? There is increasing evidence that inflammation of any kind can impact the health of individuals, as we are seeing with COVID 19. A new study has now shown that switching from a more anti inflammatory diet towards one that increases inflammation heightens the risk of breast cancer by up to 12%. Foods that increase inflammation include red and processed meats, high fat foods such as butter and frying fats, and sweets including sugar and foods high in sugar. On the contrary, fruits, vegetables, legumes, tea, and coffee have anti inflammatory properties. Dietary patterns can definitely play a role in the prevention of breast cancer, so it may be better to switch to an anti inflammatory diet with more of fresh fruits and vegetables in your diet plan. Thank you. Oh. So, the question for today is, can COVID 19 lead to skin disorders? Well, an increase in the use of personal protective equipment and increased inclination towards the hygiene measures, such as the use of hand sanitizers, hand washing, and mask usage, have increased the frequency of skin disorders during the pandemic. Additionally, there are skin issues associated with COVID 19 infection itself, and then adverse reaction to the prescription or over the counter medicines that we have to take for the infection. There is a wide range of skin manifestations, including hives and vesicular eruptions, that have been reported to be related to COVID infections. And some of these are seen in other viral infections too. However, there are some infections which come on the skin, such as chilblains, that were specific to COVID 19 and not commonly seen in other viral infections. Hair and nails have also been reported to be affected in COVID 19. The finding of alopecia or baldness and gray hair associated with severe COVID 19 was surprising. Furthermore, healthcare workers have also had to deal with skin disorders due to increased use of PPE and gloves, goggles, and gowns as per the COVID protocol in the hospital. This has led to increased incidences of folliculitis and dermatitis. Deterioration of pre-existing skin diseases has also been noted, such as increase in acne flares, seborrheic dermatitis, and rosacea. Thank you. The question for today is, can eating fruits reduce the risk of diabetes? Yes, eating fruits can help you ward off diabetes, A study is published recently in the Journal of Clinical Endocrinology and Metabolism showed that people who consumed at least 2 servings of fruit per day had higher insulin sensitivity than those who ate less than half a serving. A healthy diet, including whole fruits but not fruit juice, may have a role to play in decreasing type 2 diabetes. People with moderate total fruit intake were found to have a 36% reduced risk of having diabetes at 5 years. Previous studies have shown that a lower risk of diabetes in people who ate more blueberries, grapes, apples, pears, peaches, plums, and apricots. And this has also been linked to a lower risk of diabetes. So add those fruits into your diet and have a healthy diabetes free life. Thank you. So the question for today is, can work and social stress increase a woman's odds of getting a heart disease? Yes, psychological stress can put women at significantly higher risk of developing coronary heart disease. A recent study has shown that job strain and social strain together are associated with a 21% higher risk of developing a heart attack. High stress levels and events, high stress life events such as spouse's death, divorce, separation, or physical or verbal abuse, as well as social strain, were independently linked with a 12% and 9% higher risk of coronary heart disease, respectively. Previous studies have also shown that work strain may play a role in developing coronary heart disease, but now we know that stress at work and at home are both tied to poor health outcomes. Women Working women face a dual burden, and the COVID 19 pandemic has brought to force the challenges faced by working, working women face a dual burden, and the COVID 19 pandemic has brought to fore the challenges faced by women. Ladies, it's time to identify those stressors and work towards getting rid of them and find out constructive ways of dealing with the stress and leading healthy lives. Thank you. So, the question for today is, can I eat out at a restaurant in the current scenario? While restaurants are now open for dining, the risk of contracting COVID 19 is not over yet. Contrary to other outdoor activities such as shopping or traveling, masks need to be removed while eating, which is certainly a transmission risk. Not wearing a mask means that you could face a risk of respiratory droplet infecting you. Even if the vari- Even if the waiters around you wear a mask, you may be at risk from the one seated close by. A greater risk than outdoor dining Indoor dining could pose a greater risk than outdoor dining, as air circulation and ventilation. An important Indoor dining is more risky than outdoor dining, as air circulation and ventilation are important factors to consider in transmission. Outdoor dining with scattered seating arrangements may minimize the risk. So choose wisely if you must. Try going to a restaurant at off peak hours when there is less crowding. Go for outdoor dining with spaced out seating. Order online. Avoid touching frequently touched spaces. Wear a mask when not eating. Practice hand hygiene, and don't stay lingering on over a cup of coffee after your meal is over. Stay safe. Stay healthy. Thank you. The question for today is, will the third wave affect children more? With the increased rate of COVID 19 infection seen among kids and unavailability of vaccines, patients with the increased risk with the increased rate of COVID 19 infection seen among kids and the unavailability of vaccines, parents are worried about the safety of their children. There is fear that the third wave might impact the kid most due to a lack of vaccination. But actually, this is not the case. The Indian Academy of Pediatrics has said that although children remain prone to infection, it is highly unlikely that the third wave will probably be more in. It is highly unlikely that the third wave. I'm doing this again. Delete this. So the question for today is, will the third wave affect the children more? With the increased rate of COVID 19 infections being seen in children and the unavailability of vaccines for those under 18, parents are a worried lot about the safety of their children. There is fear that the third wave might impact the kids more because of this reason. But the Indian Academy of Pediatrics has said that although children remain prone to infection, it is highly unlikely that the third wave will predominantly or exclusively affect children. The latest reports from the Lancet say that COVID 19 The latest reports from the Lancet COVID 19 Commission India task force, which includes leading pediatric experts from all across the country, states that there is no evidence to suggest that children will be worst hit by the third wave. Keep your kids safe by teaching them COVID appropriate behavior and don't panic. Thank you. Okay.